A very good morning to everyone. We welcome you to the regional webinar, Regional Experiences in the Implementation of the Minamata Conventions, Reducing the Use of Dental Amalgam and Responsible Waste Disposal Management. I'm Dr. Carolina Holmes. I work in the Department of Health Systems in PAHO, and it is a great honor to moderate this webinar today. First of all, I'd like to give you some technical indications. This webinar is being carried out through Zoom and has simultaneous interpretation to Spanish, English, and Portuguese. We ask you to, when intervening, we ask you to speak at a moderate speed so that our interpreters can provide adequate translation. To choose the language, please click on the interpretation icon in the lower bar of the Zoom screen. Please maintain your microphones muted during the presentations given by our colleagues to avoid interference. To begin, we have the welcoming words of Dr. Caroline Chang, representative of PAHO in Uruguay, followed by Grace Hala from the UN Program for the Environment. Dr. Chang, the microphone is yours. Thank you very much, Carolina, and welcome everyone. In the name of our director, Jarvis Barbosa, I'd like to say hello, and I'd like to express our pleasure, and I'd like to say hello to all present authorities, Dr. Agustin Catal from the Ministry of Public Health of Uruguay, and each one of the speakers from Uruguay, Peru, El Salvador, Costa Rica, and Chile that today will have that we will be listening to today when they share their experiences in the project of the implementation of the Minamata Convention, advances towards reducing or eliminating dental amalgam and responsible waste management. This is a very relevant webinar for the countries and for Uruguay. The goals of this virtual encounter are aimed at presenting the history and the advances and the good practices that have been developed in Uruguay in the framework of the YES program to implement the Minamata Convention on Dental Amalgam. It has been important to favor the exchange of experiences and lessons learned, as this can become a reference for the countries that may be interested in progressively eliminating dental amalgams and carrying out responsible waste management of mercury. PAHO, once again, is committed to continue renewing its commitment towards accompanying these important efforts to take care of the environment and especially promoting dental health in our countries. We hope that this exchange today is motivating and that the countries and the whole region of the Americas can advance in this process. We are once again willing to share in Uruguay through South-South cooperations our lessons learned, experiences, and to accompany other countries. Thank you very much. Welcome, and we hope this virtual seminar is very successful. Thank you, Carolina. Thank you very much, Dr. Chang, for your words. Now I would like to invite you to hear from Grace Hala from Penuma, who has sent us a video.
Good morning, good afternoon, and good evening to all of you joining us today. It's a pleasure to welcome you on behalf of the United Nations Environment Program to this regional seminar focused on the implementation of the Minamata Convention. Specifically, efforts to reduce or eliminate the use of dental amalgam and to manage its associated waste in a sound and responsible manner. Mercury continues to pose serious risks to human health and the environment. Dental amalgam, though long used in oral health care, remains a significant source of mercury exposure and pollution. Under the Minamata Convention, countries have committed to phase down its use, an important step toward reducing global mercury emissions and safeguarding vulnerable populations. With support of the Global Environment Facility, UNEP as the implementing agency and WHO as the executing agency together have launched a project to help countries accelerate their efforts in this area. Uruguay's leadership and progress under this initiative is commendable, and we are honored to showcase the country's experience here today, alongside with contributions from several other Latin America and Caribbean countries. This event is not only about sharing achievements, but also about exchanging ideas, confronting challenges, and identifying practical ways to move forward. We hope today's discussions will offer valuable insights for strengthening mercury reduction strategies across the region and beyond. Thank you once again for being with us and for your commitment to protect both human and the planet.
Think very well. After hearing from Grace, we will continue to the intervention of Dr. Luis Francisco Sanchez, chemical advisor from PAHO, and he will be talking to us about the Minamata Convention and the importance of dental amalgam and its implications in the environment and public health. Francisco, the floor is yours. Thank you very much. A very good morning to everyone. Thank you very much for inviting me to participate in this activity, and I would like to know if you can see my presentation. We see it clearly. So in this short time, I will try to talk about relevant mercury topics and why we have a mercury agreement and why is dental amalgam included within it. I'd like to remind you that mercury is a global contaminant that is of a public health concern. And even though this is an element that is abundant in nature around the world, it is broadly used in industries. The problem with mercury is that once we have used it through water. It has a lot of mobility through water, food, and air. And aside from the persistence that it has in food, such as fish, it has also this bioaccumulation capacity that brings negative impact to health. We have different presentations of mercury, metallic mercury, what we find in nature, which has the least amount of impact on health. But once mercury contacts organic elements or is vaporized, it becomes organic or salts, and these can impact the health of people and the environment. Mercury as such is a heavy metal because it doesn't have an organic function in individuals. It is considered toxic, and therefore we consider the need to create the Minamata Convention to protect the health of people and the environment through the visible impacts of contamination. Dental amalgams have 40 or 50% of mercury, and that is why they're included in this discussion. Mercury can be found in nature due to many events, some natural, such as volcanic eruptions or rock erosion, but also due to man-made processes, such as artisanal gold mining, which may be the main source of environmental pollution. We also have industrial emissions through the use of elements that contain mercury or due to their characteristics use this element. And we also have to remember that forest fires, the trees are natural bioaccumulators for mercury. They also expel great amounts of this element. That is why fires in the Amazon are not just related to climate change, but also the release of atmospheric mercury. Now, let's remember that mercury impacts the central nervous system, the cognitive abilities of people, and can also affect fetal development and can affect growth and pregnant women. It has an important renal effect, and in the measure that mercury goes into the body, it is eliminated from the body, but it is not fast enough and it can impact health. We have referential documents for this. here. The Minamata Convention was adopted in 2013, formally adopted, and was seeking to reduce, amongst many activities, reduce the emissions and release of mercury. The convention as such is based on a accident in Minamata Bay that affected the population of that city, and that is where the decision comes to reduce the impact that it can cause on us. So, in August 16th of 2017, the UNEP recognizes through its secretariat the importance, and through that we have several other agreements. So we have had progressive recognition of the convention and adopting the activities that are proposed within. Article 4 includes measures about dental amalgams and promotes other alternatives. That resolution also invites the WHO to accompany in health matters, and in the WHO, a resolution was established that includes reducing the impact of mercury included in dental amalgams. And this resolution was issued in May 2014. Some key elements in the advances with the Minamata Convention and dental amalgam. Amalgam was part of the prior negotiations and was established within the convention, and the importance or the possibility of having a phase down, and that is to progressively eliminate mercury in amalgams, is in Annex A, Part 2. In COP3, and this is in 2021, we reaffirmed the focus on the phase down of mercury, and additional measures are adopted so that countries can present how they have reduced the reduction of amalgam with the aim to eliminate it. In COP4, we have efforts in public health policies and including other measures such as fluorination, community education, and also we saw that it was relevant to have technical and financial support in the countries so that these practices could be viable. On COP5, the last COP, there was an agreement to establish that this elimination would be through a step-down process and thinking about how we could establish other measures or compounds that can be easily accessible. We have to remember that COP4 in Geneva in 2022, the commitment towards progressively eliminate it was ratified, and the countries should advance progressively towards that elimination. In COP5 in 2023, the rhetoric, the dialogue, focused on establishing restrictions for pregnant women and children under 15 and promoting alternatives. We have to remember that the World Health Assembly in 2021 also adopted a new strategy about dental health and a health plan. Why is it important to eliminate amalgam? First, because of long-term health impact, mercury as such has been proven as a toxic element that can impact people's health and the environment. The mercury waste in health facilities has to have an adequate destination. We also have to remember that this is an ethical commitment for future generations. The work that has been carried out by countries is under the resolution of Bangkok, and here we have this phrase that is, there is no health without dental health, because our mouth is also part of our body, and we have to consider that it is important to reduce the impact that we could suffer. The progressive elimination of amalgam, to say that we are no longer having mercury pollution, is part of the global awareness to reduce pollutants that affect health. We have to think that Cavities are produced by different factors, so education is part of this strategy. Adequate dental hygiene and nutrition, and also looking for better practices in odontology, strengthening the connection between education and health. And of course, we have the regulatory frameworks in the country that are relevant. The WHO and UNEP have had two important projects. They've had several, but there's two that I think are significant. The pilot project in Kenya, Uganda, and Tanzania that have brought positive results in reducing the use of dental amalgam, and then the project of Senegal, Thailand, and Uruguay towards the safe elimination. We have several documents, so we invite you to visit the WHO page. We also have documents for the Americas and PAHO, and this is not just related to the global strategy to reduce dental amalgam, but also the results of the work that has been done in the Caribbean and other topics of interest related to mercury as a environmental pollutant through artisanal mining or consumption of fish. And additionally, we have an online course. Our PAHO website on mercury has many interesting links that can guide you towards the topics that we have in PAHO, WHO, and the virtual campus. And I tried to be succinct, and I am at your disposal for anything. Thank you very much, Dr. Sanchez, for your presentation. Very informative about mercury and the environment and what has been adopted for its elimination. Thank you very much. Now we will go to the global perspective that will be given by Gabriela Sardon by the WHO. Gabriela, I will give you the mic. Thank you very much, Carolina. Very glad to be here with you. I'm Sardon Panta, and I am a consultant of dental mouth health in the WHO. Today, I'd like to talk about reducing or progressively eliminating dental amalgam from the global, regional perspective and in the Green Environmental Fund, Global Environmental Fund. So let's begin talking about what Dr. Luis Francisco just shared about the global strategy and action plan on dental health. This is developed to respond to the proposal of dental health in 2021. That was a historic resolution. In this global action plan, we establish a clear vision of the WHO towards universal coverage of dental health for all people and communities for 2030. In this plan, we established 11 global goals, 3 strategic objectives, 100 actions that are for member states, the WHO, and other key stakeholders. One of these global goals to achieve this vision that is proposed is to advance on progressively eliminating dental amalgam, proposing that for 2030, 90% of the countries will have applied the measures in the Minamata Convention or will have eliminated it completely. So there's two ways to achieve this goal. The first one is to completely eliminate its use, and the second option is in case there hasn't been an elimination to implement the measures in the convention, including measures in COP4 of excluding the use of bulk mercury and preparing dental amalgam and excluding the use for children under the age of 15, women and pregnant women and women who are breastfeeding. And what do we see in the baseline for this goal? We see that globally, 31.4% of the countries have been able to achieve it. This is specifically in the Americas, 34% of the countries have achieved this. 37 countries have partially achieved this. And what does partially mean? It means that dental amalgam is still being used in the country, and some of the measures under the convention have been implemented, but not all of them. So this baseline or these numbers tell us that there's still a lot to do to reach this ambitious goal of 90% of the countries globally, but it also shows us that the countries are taking steps towards progressively eliminate dental amalgam. And what was mentioned previously about the Bangkok Declaration that was adopted in the Global Dental Health Meeting, Oral Dental Health Meeting in 2024, and it reinforces the commitment of the member states, given that in this declaration they establish specific commitments towards oral dental health and the environment, establishing strengthening the intersectoral collaboration to gradually reduce or eliminate the use of dental amalgam and promote preventive, less invasive oral health, adopting mercury-free products that are respectful to the environment. So, in this context, we have the project of reducing dental amalgam from GIF, whose goal is to reduce human health and the environment from the damaging effects of mercury by implementing policies and best practices to gradually reduce the use of dental amalgam. And this is a project of GETH with UNEP and the WHO with specific help from the Global Alliance on Mercury. This project has been implemented in 3 countries, Uruguay, Senegal, and Thailand. And in each country, it is being led by the Ministries of Health and Environment. Briefly, we will be hearing about the experiences, achievements, and lessons learned in Uruguay. And just like we have national results, we are also looking at global results to foster awareness raising for this topic and producing products to continue advancing in the elimination of this material. In the measure that we introduce new products, these are added to the knowledge center for the project. And in the slide, you can see the link, which has also been shared in the chat. My last slide shares with you one important achievement in this project, and that is the production of the WHO guide about oral health that is respectful to the environment and less invasive to prevent and manage dental cavities. This guide is informed by systematic reviews and has recommendations and best practices for the use of mercury-free materials with less invasive procedures that are effective and to have more sustainable options to prevent or manage dental cavities. This guide is being finalized and it will be presented as an informative document in COP6 for the Minamata Convention to carry forth the discussions on dental amalgam, given that there are 2 proposals that will be considered in the COP. If you would like to know more about this guide, I cordially invite you to register in one of the online events that will happen before COP6, where the guide will be addressed with greater details, and we will share this in the chat so that you can register. Thank you very much for your attention.
As
Thank
Gabriela
you very
just
much,
mentioned, in
Gabriela.
the chat you can
And our next
find all the
segment.
links to explore what Gabriela just mentioned. And now we're going to be listening to Engineer Judith Torres from the Ministry of Environment, Mr. Agustin Quetaro from the Public Health and National PAHO consultant in Uruguay. And now over to Judith for her talk. Mercury is a risk for health and the environment. It's a toxic metal. It's a heavy metal that is present in the Earth's crust and in small amounts. Because of anthropogenic activities, it can cause damage to the health and the environment. The role of the Ministry of the Environment of Uruguay, the framework of the Minamata Agreement on Mercury, is to be the focal point for such agreement in Uruguay, which means that it's responsible for compliance with the agreement's obligations included in this document. This project focuses basically on amalgams. The origin is that in prior years we had carried out other projects that gave us information about the main sources of mercury in our country. The main source is an industry that is regulated and has on the way of a technological transformation. And the second one is a product including mercury. With a mercury product, in regards to mercury products, we developed legislation that encompasses it, but the dental amalgam issue was still pending. During COP4 in 2022, we modified the annex that included dispositions relating to amalgams. And in that framework, it was established that the use of bulk mercury should not be allowed for odontological use. And Uruguay was invited to participate in the design of this project to its submission as a pilot country in Latin America and the Caribbean. The other countries that are part of this global project. One is in Africa and the other was in Asia Pacific. And in this respect, Uruguay has already developed legislation that addresses the main sources. So the intention of this project is to completely eliminate the use of amalgam in Uruguay. Uruguay was invited to a project of these characteristics because of its progress in the environmental regulations concerning added mercury, and because of its commitment to multilateral agreements, and because of its potential of becoming a point of reference in regards of innovative solutions in this respect. The project focuses on an important environmental issue, and that's the residue management, because in Uruguay, this amalgam technique is not taught for several years in the dentistry departments of the university. We also have imports of liquid amalgam and dosified amalgams, and for several years, the integrated health system has removed it from its services. Therefore, the reduction of the liabilities is an important issue in this project. The collection, treatment, transportation, and final disposition of mercury residues has to address a number of issues. In the first one, the dispersal of residues throughout the territory. Therefore, it is important to coordinate with the health centers and the places where these residues have been reported. Also, transport is an important element. Transport has to be enabled and appropriate for this type of residues. key element in a recollection is not to create additional residues that are contaminated by a toxic material such as mercury. And another is that treatment and final disposition has to be done locally by companies that are authorized by the Ministry of the Environment. Local treatment of mercury residues is carried out through a stabilization technique, and then a final disposition that is environmentally appropriate at the site of a final disposal of industrial residues in Montevideo. Thanks to this progress, the country has installed the capacities for the interinstitutional coordination, not only between the ministers of the environment and the ministers of health, but among all those agencies that have responsibility over this type of health residues. Another installed capacity in Uruguay has to do with the compliance with the disposition of the Minamata Agreement, not only in regards of amalgams, but also residues. The preparation, the drafting of flyers and organizing workshops to inform about this issue to health professionals and the public at large. Actor mapping, and a prevention of a subsequent generation of mercury residues as well. Outstanding. Now, let us hear to Dr. Monica Mendez and Dr. Cataldo, who will be discussing the project. Good morning, everybody. It's a pleasure to send regards from Uruguay to participate in this sharing experience with a direct impact on the health and life of our communities. I would like to start by repeating something that Luis Francisco just said, and which is that there is no health without oral health. This summarizes the challenge we face to integrate oral health as a component of general health. At the Ministry of Public Health in Uruguay, we have assumed this principle as the access of our activities, and that's why we want to share with you today Uruguay's experience in the framework of the DEF project for the phasing out of dental amalgam. When we talked about oral health, we should start by talking about the prevention of disease and the promotion of health. Our greatest success in a health system is to get there before the disease is installed. In the particular case of amalgam, this means that we are able to prevent dental cavities and the access to cleanliness tools in the everyday life of people. The project to gradually reduce dental amalgam has been critical in making a qualitative leap forward in prevention to develop innovative materials for the health professionals and the population at large. In the professional arena, it has allowed us to prepare documents that strengthen the importance of a promotion, prevention, and the role of education and health in the case of oral health. In addition, for the citizens at large, we have been able to design two leaflets, as shown here, one for oral health and another specifically about dental amalgam, and then another one about the basic health oral health. These documents have a double purpose: to sensitize and educate, and it allowed to convey clear, simple messages that are visually attractive that we can take to the population at large regarding of their age, education level, or location, residence. However, we cannot forget that the reality that we need to address is also shared by Uruguay with the rest of the world. This makes us think not only in prevention but also in how to address the issue safely. And this is where the project has also meant significant progress for Uruguay. Uruguay had already taken some measures, as I shown in the video before almost 15 years ago. The odontology department at the University of Uruguay does not teach using amalgam in about almost 10 years ago by a presidential decree. The amalgam was removed from the National Comprehensive Health Service provisions and services. This has allowed to consolidate a comprehensive closure of the use of amalgam, and that includes the social, academic, and clinical aspects. Like that's how we reached our colleagues with the documents and in workshops concerning the use of amalgam to provide safe mechanisms for the final disposal of amalgams, to prevent environmental risk and support the adoption of restoration materials that are safer for people and the environment. In this way, we started to close this historical chapter, not only in public health policies, but also as an responsible environmental policy. Another essential consideration was the training of human resources, health human resources. The challenge is not only technical, but it's also communicational. Dentists, odontologists must be prepared to explain our patients why amalgam is not the best option, and to inform our patients that there are no risks in keeping amalgam in a good condition if it's already in the mouth, and to guide them as the procedures to remove them as a proper, and to inform about alternative materials and the benefits. The project allowed us to create specific materials about these alternatives to assure that professionals have the appropriate tools to apply safe treatments and to accompany the people in making informed decisions. This is key. This is not a single-sided decision for the system, but a participatory educational process where people have the right to understand and what are the problems, their health problems, and what their options. And I would like to underscore two dimensions that cut across these works. That's the social and the environmental sides. In regards to the social side, we know that oral health has a direct impact on the quality of living, self-esteem, and education and work of people. A healthy mouth shows not only the absence of a disease, but also it's a tool to connect with society. Regarding the environment, this has allowed us to phase out material that not only impacts adversely health, but also creates risks to the environment. The appropriate disposal of amalgam is something that we must all pay attention to. By conclusion, this impact has allowed Uruguay to strengthen the prevention and promotion as strategic pillars to consolidate the historical process to remove amalgam, to train professionals to appropriately guide the population and develop innovative materials for education and communication and health education and communication, and to assure a comprehensive approach that includes health, society, and the environment. This, I am persuaded that this road will strengthen us not only as a country but as the region, and allows us to move towards a health system that is more fair, more preventive, and more sustainable. Thanks for the opportunity of sharing this experience, and so that together we can build oral health that is part of the community's comprehensive health. Thank you very much, Augustine. Now we're going to pass the microphone to Monica. Good afternoon, good morning. It is really a pleasure to share with you this experience that we do daily in our multidisciplinary team. To provide a little bit of a context, everybody knows that Uruguay is a very small country with 3.5 million people distributed basically in the capital city of Montevideo that has the national comprehensive health system that includes both the public and private providers, and private medical collective institutions. But when we talk about odontology, according to the 2023 census, we have about 4,500 dentists, of which over 3,000 are free professionals. This is it's important to be aware that reaching out these independent professionals is hard to reach. When it comes to dissemination and training, also there are private clinics and cooperative clinics and dentist associations. So to address the component 2 of this project, there is the resident disposal component. We have to prepare a nationwide mapping, and we need for that relevant tools like questionnaires, and one with mercury-free restoration materials, and the other one in dental amalgam. We wanted to address how these materials are residues are treated. I wanted to underscore that there were very few answers, which means that the figures that we can avail ourselves of are not statistically representative figures, but nevertheless, they show us the scenario that we're in, and that is aligned with the agreement, the information that we have from many other sources. Amalgam has been practically eliminated. Only 2% of survey respondents still use it, and the amalgam stock uses this input for preparing mercury for preparing amalgams. Still, we have 12 departments in 35 points. That's dental offices, whether private or public. And there we have found between 40 and 50 kilograms of mercury, mostly liquid mercury. Why is there so much liquid mercury, and how was there such a quick evolution from using amalgam to restoration materials, and only pre-dosification capsules were used for a short time and a small amount, and which is one of the issues that are addressed in the agreement towards the subsequent elimination of dental amalgam. All this has to do with what Judith and Agustin mentioned in regards of preparing training days and awareness raising workshops. For now, if we look at this from the gender approach, we may hold that dentists and hygiene experts and assistants, and the patients as well, include a significant number of women. This is a very feminine profession. Caretakers of a family health are the ones that go to the dental offices, and the profession itself is also highly feminine in Uruguay. And this shows how this process. This storyline of the removal of amalgam in Uruguay is not, it has a multiplicity of causes and has to do with many things that have already been mentioned, like the concern because of the impact of mercury in the environment, and that has resulted in the Minamata Agreement and many other national and international projects to minimize the negative impact of this metal on the environment. And from the viewpoint of oral health, there's been a change in paradigms to move towards a minimally invasive odontology, underscoring the promotion of oral health. This goes hand in hand with the technological developments that have resulted in restoration materials that are better quality and a cheaper cost, including advanced technological techniques. And as Agustin mentioned, academia has for several years already stopped including its study programs, amalgams, as a practice. And the population is not excluded from this effort because, in addition to the health concerns, there is a concern about the aesthetic concern, which has moved towards the change to the use of other materials. And last but not least, we have the ability in our country to manage and treat residues. In 2020, a treatment plant started operating thanks to a prior mercury project that is funded by GEF, the Global Environmental Facility. This transparency and the next one basically show the more detailed information that you can examine in more detail later, but it shows the milestones that include government initiatives, decrease imports of mercury products, and residue disposal, and removing then I'm again from the list government lists health provisions and other related to the Minamata. In 26, there was a regional study on pregnant women and newborns. We found that there's 2% presence of amalgams in this population, which we thought was enough, not very high, low. And this shows the storyline and shows that this project has made a lot of progress with, but now with a focus on residue management. Next. In 2017, the framework of the Euro 13G32 included several projects, including amalgam and control of amalgam and mercury Uruguay from the Department of Dentistry that addresses the importance of this issue and prepared guidelines for the storage, transportation, and labeling of mercury residues and their impact on the environment. Now, I would like to tell you what we're working on. This is the residue management plan nationwide. This image shows one of the our country is divided in 5 routes. This is the north route, and then to the east and west we have 2 other routes to prepare residue management plan. We need trained personnel and a company. So one of our first action was to hire an expert in this respect, a chemical engineer that is a PAHO consultant and who prepared the logistic plan for this stage. And to this end, they were based on the initial situational results to prepare a geo-referenced map for mercury that could subsequent residues that could subsequently would be collected. Initially, the idea of collecting centrally the materials turned out to be too expensive. And so the idea was to collect them from each of these sites. And once these sites had been identified, we made a call for bids for the company. We only have one company in Uruguay that is managed by Dinasia for residue treatment, and that has two types, micro and micro encapsulation. The company does a macro encapsulating because that's what they have been enabled to, authorized to do. And this has to do with residues like, for example, capsules, and to amalgamate them and to create a solid residues that are subsequently stabilized using sulfur sulfides. And this is a plastic contents that is added, put into cement that is finally disposed of in the industrial chamber of Uruguay's disposal set. All that has to do with the collection and conditioning, packaging, transportation has to follow international and national standards. So the company was hired, and now an additional collection has been done nationwide along those five routes. That's 35 points, collection points, and now we are going through a second stage, so to speak, because we are still working on the dissemination, and there's always new issues. There is an open work window, and we also medical to importers of dental inputs for dental amalgam in particular to get rid of their stocks, because the idea is that as of next year, no amalgams will be allowed to be produced. So, why no more amalgam production? Because we are not treating residues until their final disposal, but we are also working on the regulations by both ministries, health and environment, to prepare an ordinance or decree, an order that will regulate the amount of fluor in toothpaste within a given certain range. Not and silver diamond fluoride at 38% seems to be sufficient to be used as peristaltic, but in Euro-wide, this level is at 29%. And from the environmental viewpoint, the objective is to include amalgam in Decree 15/2019 that has to do with the regulation of mercury residues from light bulbs, thermometers, and that did not include yet dental amalgam because that was supposed to be gradually phased out, so included in this decree. So in addition to the residues, it also will regulate imports. So my conclusion we have seen is that the situation that Uruguay is in right now is the result of a ministry, academic, people, science, and many other efforts that have been carried out since 2006. But there is a number of residues that is still significant that has to be treated properly. Well, thank you very much for your attention and for participating together with you in this seminar. And thank you very much, Monica, Agustin, and for sharing the Uruguayan experience. I think this experience has allowed to underscore the importance of moving towards more safer and more relevant environmental management. And for all those of you who are sharing with us the experience that was shared by Uruguay, shows not only their accomplishment but also the challenges that we still region want to protect people's health and the environment. If you have any questions, please write them in the Q&A box, and we will try to address them during the seminar.
I would like to remind the panelists that it is important to have brief and concrete answers. We've allowed 2 minutes to give all our colleagues a chance to intervene. So I would like to invite the representatives of the countries that are joining us to turn on their cameras. Today we have Dr. Carolina Mendoza, Head of Oral Health in Chile, Leslie Tuesta Orbe from the technical team of the Ministry of Health of Peru, Dr. Carlos Grajeda, technician in comprehensive management of dangerous waste from El Salvador, and Dr. Ana Gabriela Fallas from the governing area of health in the Ministry of Health of Costa Rica. Thank you very much, everyone, for accepting the invitation. And to begin, I would like to launch a question to break the ice and to get to know the situation of the countries and to open up the conversation. So the question for you is, what is the current contents regarding the use of dental amalgam, and what key measures have you taken to reduce or eliminate it in your countries? I will begin according to the order that I have here on my screen. So we will go first with Dr. Mendoza from Chile. Thank you very much, Carolina, for the invitation. It's important to have these spaces to share our experiences. Well, in Chile, and according to the information that we have available, in 2024, the amalgam use represents 0.0% of the procedures carried out in public health facilities. The main measures that have been implemented are aligned to the proposals in the Minamata Convention, and they address different dimensions. For example, there are national goals for the prevention of dental cavities that is manifested through our national oral health plan for the decade of 2030, that 21 to 30, that it proposes to improving the dental health of the population with a gender focus. We've also established national goals meant to reduce the use of dental amalgam incorporated in the National Oral Health Plan. We promote the use of mercury-free alternatives by producing evidence-based clinical practice guides, and also programs that favor discouraging the use of amalgam, encouraging the use of mercury-free material and minimally invasive alternatives, also promoting the use of best environmental practices through the regulation on waste management in public health facilities, which is a regulation that applies to all health facilities. So this is the situation in our country. Thank you very much, Dr. Mendoza, for your answer. Now I would like to invite Leslie Tuesta from Peru to answer the question. How are you? And good morning, everyone. Thank you very much for inviting me. Well, to answer the question, Peru, by subscribing the Minamata Convention, has implemented through sectorial dispositions the many actions to reduce the use of dental amalgam, reducing its use to determine population groups and other specific considerations. The projections of the Peruvian state are aiming to have a complete elimination in the medium term. The reports that have been obtained in the last few years in outpatient treatments in health facilities in the public sector show us a considerable progressive reduction of about 80%. Nonetheless, we still have we're still missing the information from the private sector. Within the main analyzed measures that have been adopted by the Peruvian state, these are aimed at strengthening the regulatory framework under three fundamental pillars, and this is an ongoing process. The main pillar is to have a focus backing on the formulation, approval, and implementation of the technical standard for the use of dental amalgam that is the main regulatory tool, and given that through its dispositions it will guarantee the progressive reduction and control of use of amalgam in dental health in the different health facilities in our country. So the Peruvian state, through the oral health division in our Ministry of Health, is considering strengthening prevention of cavities, another activity, and timely intervention for cavities through minimally invasive procedures. And in this sense, we are formulating the regulatory document for minimal intervention of dental cavities document. This document is currently being produced and it's pending approval and publication. We consider that the document will be approved by the end of the year or for the first quarter of the next. And a third pillar is that the Ministry of Health, through ministerial resolution, has approved a regulatory document of national research priorities for dental health for a period of 2022 to 26 that is promoting the development of quality materials without mercury for dental treatment. And in coordination with the Ministry of the Environment, we have established within the bill that is being drafted the waste management in the Minamata Convention, the incorporation of articles with dispositions to guarantee compliance of the regulatory framework developed by the Ministry of Health. Under this scenario, Peru has removed from its administrative management system the silver and mercury, reducing procurement to the units in the Ministry of Health. Thank you. Thank you very much, Dr. Tuesta, for your answer. Now I would like to go to Dr. Grajea from El Salvador. Good morning, and thank you very much for this space. In the national context of Ecuador is that dental amalgam is not used in the public sector, and the tool that allowed us to do this is that in 2021 we issued the National Plan of Dental Health through the Oral Health Office in the Ministry of Health of El Salvador, transforming the public procurement strategies according to international instruments that have been ratified by El Salvador, mainly the Minamata Convention, and therefore the public procurement processes prioritized innovation and modernization that eliminated the purchase of dental amalgam, and this has created an effective elimination in the public context and a reduction in the private sector. And this is how, since 2021, the import records for commercial amalgam has not, or the licenses have not been renewed. And this has meant that in the public sector, dental amalgam is not available, and therefore we have better alternatives such as biomaterials. Thank you. Thank you very much, Dr. Grajea. Now I would like to go with Dr. Paya from Costa Rica. A very good morning. For Costa Rica, the Legislative Assembly approved the convention in 2016 through a national law 9391 and later ratified on November 7th of 2016 through Decree 40053, and it became applicable in 2017. So for 2019, Dr. Denis Angulo, at that time Vice Minister of Health, they formed a commission to produce a proposal to implement the measures in the convention referring to the control of use of products with mercury in dental care in the country. And there was an institutional interdisciplinary group formed that included Social Security workers, academia, and other entities such as the IAI, which is the Water Systems Institute and Environmental Management and Radiological Protection. All of this was coordinated through DHKMINAI to work on the topic. At the time, there was agreement on an initial proposal through a letter issued by Dr. Daniel Salas, at the time Minister of Health, where we talked about eradicating the use of amalgam in Costa Rican population by 2030, with certain exceptions to be able to comply with the date where we should have extensive treatment in difficult pieces and the development of pieces, and for people that had uh, neuro deficiencies. There was also a survey by the School of Dental Surgeons of Costa Rica with the purpose of complying with the dispositions of the second part of Annex A of the Minamata Convention. It is also important to mention that in parallel, we worked with the National Policy of Dental Health, and this is being reformulated currently, and we also have the work related to the convention. This is what I can bring here. Thank you very much. Thank you very much, Ana Gabriela. Excellent. And we'd like to thank all the panelists for providing context. Now that we know the context of your countries regarding the use of dental amalgam, I would like to ask a more specific question to each one of you. So I will begin with Dr. Mendoza from Chile again. For Chile, the question would be, in the National Dental Oral Health Plan 2021-2030 and the report on the use of dental amalgam, what advances has there been in the plan to reduce the use of amalgam? And for the countries that are in a transition phase, what are the key steps to begin the plan for reduction or elimination of its use? In our country, the National Plan for Oral Health has a challenge that is updating regulation with protecting the quality of care and to safeguard the safety of the patient. So we want to design a plan to reduce the use of dental amalgam in dental care. Tied to the conditions under the Minamata Convention. To face this challenge, we would like to have statistics on the use of dental amalgam. And with that purpose, in 2023, we published the report in the public system that showed us that in 2022, treatment with dental amalgam only represents 1% of the total number of treatments, and this was focused on people with from 20 to 64 years of age. Since that report was published, the use of dental amalgam has continued dropping, and in 2024, the total use of dental amalgams represents 0.6% of the total number of treatments, and this is the lowest number registered since 2007. The use is focused on people between 20 and 64%, and women represent 33% of this. To continue advancing on the reduction of the use of amalgam, we have proposed different measures. First, to reinforce the advances that were achieved in implementing strategies to prevent dental cavities and to improve the coverage and opportunity of dental services in the health networks. Also continue discussing the agreements and commitments made by the country in the context of the Minamata Convention, informing managing teams and clinical teams throughout the country. We also have to reinforce within dental teams the indications to privilege minimally invasive techniques and materials without mercury in all ages throughout life. And finally, identify barriers in the different territories to use those minimally invasive techniques and mercury-free materials to design strategies that are territorially relevant. Thank you very much.
Thank you very much, Dr. Mendoza. And now we're going to turn it over to Dr. Tuesta from Peru. The question for you is what the concrete examples have been introduced by the new technical norm on the use of dental amalgam and residue management, and what control and auditing mechanisms are being used to verify compliance? Yes, thanks very much for the question. The health technical norm for the use of dental amalgam has been enforced since this year. It was approved in December last year, creates the legal normative framework that was required by the Peruvian state because it provides the legal support for actions aimed at reducing the use of amalgam and its projection towards its total elimination in the medium term. This norm establishes the prohibition to use amalgam dental restorations, in particular among pregnant women, lactating women, boys and girls, and women that are planning to become pregnant, and women, persons that work in mining areas or areas where there is high mining exposure, patients that are allergic to dental amalgam components, and persons with renal insufficiencies, and it restricts its use to the groups of the population because of their specific conditions or because of the social cultural considerations. Still consider that the use of dental amalgam is still required. It also forbids the use of a bulk mercury and reduces the use of amalgam to dosify the capsules. It also establishes priorities for the use of mercury-free restoration material included in the technical health disposition. It is established the comprehensive management and the use of dental amalgam residues, including, for instance, the installation and maintenance of a dental system, including a trap or separation material that holds the amalgam residues that are rejected by dental facilities, that prevents their pouring into the drainage system. It also includes the final disposal of amalgam residues from health facilities all the way to the organic departments of the Ministry of Health that are responsible for the disposal of these residues, including the control and surveillance measures to carry out this process. These activities are carried out prior coordination with the Ministry of Health organic departments that are responsible for compliance with the dispositions that are included in the normative document, including the National Health Superintendent, the Directorate for Medicines and Drugs, and the Oral Health Department. All this is subject to follow up and of reports that are supported by the existing Peruvian legal dispositions for that end. Thank you very much, Leslie. And now we're going to turn it over to Dr. Coher, who will be talking to us about Salvador's experience in the process of eliminating dental amalgam. What challenges have you faced in the implementation stage, whether logistics, cost, acceptance by the professionals, or the population at large, and how did you overcome them? Thank you. In Salvador, we're going through a process to remove this input. And one of the main challenges is to overcome the professional inertia because of the historical dependence on the use of amalgam. We want our professional dentists in the public sector to feel that are very competent and safe when using new alternative materials that are already available in market and that the government procures through its oral health plan. And for this reason, thanks to a training course that was taught by the University of El Salvador on contemporary dentistry techniques and the use of materials. The government supported the training of public sector professionals in the use of these new materials so that they would be ready for this transition in the use of amalgam to the new materials and technologies. However, there is still work that remains to be done because there is still a number of professionals that need to be trained. But we also have to underscore the role of the academia because they have played an important role in this transition process. One of the main challenges that we still face is the final disposal of the amalgam stock that it's no longer used by public institutions because at present we do not have a well-established environmental nationwide management system. Therefore, those stocks are being this is issue that is being addressed together with the environmental authorities and the health authorities so that we can find solutions in the medium term to overcome these challenges that we have faced in this elimination process, amalgam elimination process. Thank you very much, Dr. Graham. Outstanding. And I would like to turn it over to Dr. Fayez from Costa Rica. For Costa Rica, the question is, how have you trained health personnel in using alternative materials in appropriate residue management disposal? Thank you. In Costa Rica, at the universities, the students are already provided the information about alternative materials available alternative materials in regards of professionals that are already in practice for some time. Many of them what they are using instead is what they are doing is reducing the use of dental amalgam, and they will only use it in those comments that I mentioned earlier to support prosthesis and etc. But it's important to mention that from the environmental quality management by the Ministry of the Environment and Energy, they have already provided a training health professionals regarding the use of dental materials, and also the Dental Surgeons Association provides continuous training in this respect. So the work that is done oftentimes is basically when they have to remove an amalgam, and when reducing this dental amalgam, the residue has to be disposed of, and we have at a country level the work that's being done in regards to the agreement, because there is no a center where mercury can be treated. Occasionally, through agreements, it is impossible to send it to other countries like Switzerland. So this is a part of the initiatives that we have to engage in again. And regarding the dentists no longer using amalgam, they're doing everything as possible to use other equipment and materials for providing patients care, dental care in this case. And yes, thank you very much, Ana Gabriela, and thanks to everybody to the panelists for sharing their experiences and the work they are doing in their corresponding countries and the effort in moving forward and sharing their lessons learned, guidelines, and lessons learned towards the gradual elimination of dental amalgams. In the next section, we will be talking about the key recommendations and by Gabriela Cedun and Agustin Quintero. Agustin, Gabriela, over to you, please. Thank you. Thank you, Carolina. Thanks for the transparencies. So, together with Agustin, we're going to be sharing some key messages to further strengthen our road towards the gradual phasing out of dental amalgam throughout the region. And I only have 2 slides that I'm going to share with you to share some key messages. But to speed up in our work in the framework of the Minamata Agreement and the action plan of oral health, in to further move towards accomplishing this goal, we have to strengthen interministry collaboration between the environmental and health sectors to totally remove dental amalgams whenever possible, as has already happened in some countries that are moving in this direction. And also, if this is not totally possible, to adopt a gradual approach by eliminating its use in vulnerable populations and in the use of bulk mercury. And it is also important to drive these efforts towards the 2030 objective is to set forth concrete measures with defined deadlines or the measures that will be taken, like, for instance, including these issues in regulations, curricula, the use by health insurance systems, and also align all this with the action plan, the World Action Plan for oral health. We include these essential oral health services in a primary care, so that by 2030 we will reach the universal coverage, including mercury free, effective, and safe measures to manage dental caries. And I also wanted to share with you that there are opportunities for learning and cooperation throughout the region. And in the chat box, I'm sharing the links so that you can access more information about these encounters. In the first place, soon we will have a COP6 of the Minamata Agreement. There will be on prior preparation online events from the 13th to 17th October, and there are events that will be focusing on residue management. And it'd be great if you could attend these events for gathering more information, and there'll be other events for dental amalgams. There are 3 events which will be providing important information about that will be taken into consideration at COP6. 2 proposals will be discussed to amend the provisions concerning a dental amalgam, and including the total removal or elimination by 2030. Another important event that's worth mentioning has to do with the upcoming regional seminar related to actions in health in the framework of the Minamata Agreement by PAHO. That'll be taking place on October 29th. You're all invited to attend this significant event. And in the framework of the GEFA project that we have shared with you, there will be an in-presence workshop by invitation that has been planned for March 2026. And also wanted to share with you two links so that you can access more information about the project and access the researches that are being prepared. And finally, I want to share with you that we're thinking of a new project, a new GIF project for the GIF 9 cycle. This is still in its very initial steps. I wanted to share with you that we're still making progress in speeding up the gradual phasing out of dental amalgams so that it can reach the objectives that they have been set forth by the program project for 2030. And now I'm going to turn it over to Agustin to share his thoughts, insights with you. Yes, I wanted to share also with you a final takeaway before we closing of the seminar by Wilson. It has been an honor to share this dialogue and exchange and sharing and collective learning space. Throughout the seminar, we have realized that a gradual phasing out of dental amalgams is not an isolated country issue, but a global commitment to health and the environment in the framework of the Minamata Agreement. We underscore the importance of academic training, public policies, and institutional coordination to move forward in a sustained process that's been in place for over a decade. It has underscored the importance of a prevention in oral health, in working towards safe, restorative alternatives, and to give professionals clear tools to inform the population on a responsible basis. I would also like to share with you some challenges and recommendations for the whole region. We understand that strengthening regional and global articulation is important, and knowledge that is shared in these spaces is key for countries so that the countries will not have to travel without support from others by themselves to prepare plans and standards for amalgam elimination that will introduce in concrete regulations, investing in training and communication, risk communication for professionals and the citizenship to inform and to alert uh, is important to be done and to manage a proper disposal of amalgam residues to loop the loop of environmental health protection. And the key message that I want to share with you is that there is no health without oral health. And transition towards the elimination of amalgam is at the end of the day an opportunity to strengthen prevention and a social equity. And I want to thank PAHO and the WHO and the environmental health agencies as that are engaged in this project to the final removal of dental amalgam, and in particular my colleagues from the health sector in Uruguay, and thanking them to assure them that to making a reality, to making environmental health and for the people a reality. Thanks, Agustin and Gabriela, for these messages that you have shared with us. And as Agustin mentioned, I'm going to turn it over to our colleague Wilson Peña, who is the technical system for health services of the PAHO office in Uruguay, to close this seminar, virtual seminar. Thank you very much, Carolina, and thanks to all the speakers. And I just wanted to share with you these final thoughts. to address the colleagues from other country offices. In the Uruguay office, we have learned a lot with this project. It was a big challenge, and working together with our colleagues from the various areas during this time has resulted in some key learnings. The main one is, as has already been mentioned by the speakers from other countries, is that it is possible to comply with a minimum agreement. That is perfectly possible. So let's strengthen our efforts in each country in their own national conditions, because this is possible, and the international agreements are there to be enforced and to be used as a goals to which we must move forward. And how did we learn that progress is being made? On the one hand, because of the great international cooperation, interagency collaboration effort. We worked with environmental program, and our colleagues from Geneva, the World Health Organization, our country teams, the PAHO country teams. These interagency collaboration is not difficult, because we all have a different ways of doing things, but we can also add up all these systems. And inside each country, the critical path seems to be, and this has been demonstrated by the process in Uruguay, and you can also see that in other countries. Intersector coordination is critical. The decisive commitment, political commitment to bring together all government agencies and other from other areas as well, in a clear public policies that involves the Ministry of the Environment, the Ministry of Health, health providers, academia, as has been mentioned repeatedly, so that the new dentists are aware of this matter, and also the private sector. If you not involve the private sector, it's going to be very hard to accomplish final, definitive, stable changes in this field. But perhaps an even more important thing that we have learned in Uruguay is that for these public policies to become state policies, it is important to reach political agreement at the highest level. Because when administrations change, priorities change. So to make a public policy, state policy implies a very relevant technical and accumulation process. And finally, something that happened to us that is very peculiar in Uruguay is that a challenge that came from the environmental health field became a stimulus to foster health prevention, oral health prevention policies. There's a synergy between two areas that are apparently different, is really very interesting options. To start with the environmental side, to move oral health is a very important learning. These are my final thoughts, and also take the greetings from our country representative, but we still have a few months ahead of us to work on the various agreement projects and to make it available at the regionally and worldwide. In the have a project, a global knowledge sharing platform.